Hi everybody and welcome back. It's Dr. Matthew Hertert here again with Centre Chiropractic in Boalsburg, Pennsylvania, just outside State College and Penn State University. And what I want to do today is talk to you for a few minutes about pregnancy and how that relates to chiropractic or chiropractic for the pregnant client. First, I want to introduce my dear friend Mandy Sargent. She's a yoga instructor here in the area and a pretty exceptional one. She's got a very loving and healing presence, one that touches me deeply each time I see her. To be fully forthcoming, Mandy's just about my best friend in town, probably next to my wife, so you have to take my referral here with a grain of salt. But I think anecdotally, but objectively, she really has had one of the fastest growing practices that I've seen with any kind of healthcare practitioner in my life, with any kind of practice. So I think that speaks a lot to her value as a practitioner. And so if you're looking for somebody to guide you into that process, she's a great resource for you there. And thanks to her today, as you'll notice, she's quite pregnant, so sitting here for 5 minutes while I yap is very much appreciated. So thanks for being of service to everybody today. Philosophically, chiropractic for the pregnant client is just really important. It's a really important thing to consider if you're somebody who wants to have the most easy and graceful experience of pregnancy that you can, and certainly if you're oriented towards the maximizing the health of your baby and how the baby comes into the world. At the most basic level, there's no reason to be in more pain or discomfort than is necessary throughout the process of pregnancy. The other level of that I think a lot of people don't consider is that if you're in pain and you're carrying a baby, your body is not only producing more stress hormones, but the biochemistry of your body will change with pain and with swelling, and swelling almost always comes with any kind of injury that's going to cause you discomfort. All those changes can affect the normal developmental environment for your baby. So it's not to say that your baby's going to get sick, but you want to do everything you can during the pregnancy process to have as healthy a baby as you can, to have as comfortable a pregnancy as you can, and certainly as easy and graceful a labor as you can. There was one study that was conducted some years ago actually between a medical doctor and a doctor of chiropractic that looked at chiropractic treatment for pregnant women, for pregnant clients. And that study found that more than 75% of the women reported either major or entire complete relief from neck pain, mid-back pain, low back pain, even things like headache and vertigo under chiropractic care during the pregnancy. And there is a huge body of anecdotal evidence out there amongst chiropractors who specialize in pediatrics or maternity like I do that really implies or suggests that labor can be more comfortable or shorter when you've been under regular chiropractic care. Now, what that looks like for most women, according to the literature and also my clinical experience, because I do try and follow the literature, most women during pregnancy tend to come in about once a month during the first trimester, usually twice a month during the second trimester, and sometimes either twice a month or even weekly during the third trimester. It has a lot to do with a lot of other variables in your life, just like it does with every other client, whether you're exercising, what kind of exercise, how connected you are to your body, if you've got other underlying or pre-existing health conditions. So obviously there's a lot of variation there. There have been some pretty extensive studies looking at the kinds of things that can occur with nerve pressure as a result of misalignments in the spine and how it negatively affects the fetus. Without going into a lot of detail about that, I'll say that the researchers who really looked at that were working with laboratory rodents, and they found some pretty significant changes in utero, and then also things that seem to be different about those babies, those rodent babies once they were born. Nerve pressure affects physiology, and physiology, in this case, really relates to the abdomen and the uterus, so it's an important thing to keep in mind. The same research also pointed out that there is empirical evidence in the literature that indicates that couples who've had problems with infertility have been able to get pregnant under the care of osteopathic medicine. And DOs, doctors of osteopathy, really do the same thing that doctors of chiropractic do. They're adjusting the joints. Not so much to relieve nerve pressure, but more to help the blood vessels, the vascular system work better. But the point there is the same, that seems to have great benefit. Now, in general, adjusting with pregnant clients is not that much different than what you've seen in the other videos. The one major difference to appreciate is that because your body is producing more progesterone and a hormone called relaxin both of which are designed to soften and loosen the ligaments so that the baby can be birthed without really causing you serious harm. Ligaments can't be rehabilitated during pregnancy the same way they can in a body that's not pregnant, because they're going to stay more loose and elastic, and the ligaments are what hold the joints in proper alignment. It's one of the reasons that you see the increased frequency of adjusting throughout the course of pregnancy, is because you just can't hold adjustments in the same way. So other than that, there's really not a whole lot of difference in terms of the normal adjustments you'd see day to day. One thing that is really distinctive about chiropractic care is what's called the Webster technique. It was developed by a doctor of chiropractic who developed this over the course of many years in practice, working with kids and pregnant women. He applied his technique to over 800 pregnant women in practice who presented with a breech position of the baby. If you don't know what that is, that's probably a good thing, because it probably means that you're not having to work with that. What breech position describes is when the baby in the last months or last weeks of pregnancy is laying sideways across the uterus instead of being head down, which is the normal delivery position. So it can be uncomfortable for the baby, certainly uncomfortable for the mother, and there's always a concern there about whether labor is going to be a problem because the baby's not in the normal position. So this technique is not designed to manipulate the baby from the outside. We're not trying to turn or twist the baby. What we're trying to do is help the joints be in their proper position and help muscles be as symmetrical and relaxed left to right and front to back as is possible. One way to think about this is that your uterus is basically a giant muscle in the shape of a bag, but it's a giant muscle that hangs from ligaments from the inside of your pelvis. So if you've got unequal leg length, if you've got a lot of pelvic asymmetry or rotation, if you've got muscle asymmetry left to right that's pulling your pelvis out of position, because the uterus hangs from the bones, your uterus is going to end up being torqued. So one analogy for this is going into labor with your baby in a position like that, or the baby trying to assume a normal position, head down when the uterus is torqued, would be akin to trying to run down the block with a Charlie horse in your calf. It's just not going to work well. It's going to be uncomfortable. So that's really what this technique is designed to do, is to allow everything to settle into a normal position here. Now this is a very widely accepted technique because it is so conservative, it is so safe, and certainly more conservative and safe than the other kinds of measures that are undertaken in the case of a breech presentation. I've had not only midwives refer clients here for Webster technique, but I've even had nurses and obstetricians in the area send people here. So this is really widely embraced. And the only thing you'd want to consider in making choices about this if you're outside central Pennsylvania is you really only want to see a doctor of chiropractic or a doctor of osteopathy for this. Part of Webster technique does involve adjusting one of the joints, and it's only really in the scope of practice of chiropractors and osteopaths. We're the only ones who really received extensive education and training on adjusting. So you really want to make sure you're with somebody there who knows what they're doing. So in a minute here, we're going to move Mandy over to the bench and we'll show you what this looks like. So really the first step in the assessment with Webster here is to look for rotation of the sacrum, which is the big triangular bone in your pelvis here. And we're going to do that in a face-down position on this bench that you've hopefully seen before in the other videos. What's a little bit different this time is that the abdominal piece is down here. A lot of chiropractic tables, especially ones that practitioners who specialize in pediatrics or maternity use, have a way to adjust or lock down the middle part here so that it's more comfortable for mama, obviously, and more importantly, AJ in this case, so that there's room for him. So come on over. So just like the other, adjustments, we're going to make sure that this is adjusted for you height-wise so that you're comfortable. We're going to let you down nice and easy here. And really what we're trying to do here is figure out which side of the sacrum has rotated backwards. That's the primary thing that needs to be corrected to allow all those ligaments and muscles to settle into the right position, for the uterus to release that torque so that the baby can hopefully shift into that proper head down, vertex down position. The assessment here is really simple. It really couldn't be any simpler, actually. We're just going to bring your heels, or in this case Mandy's heels, upwards towards the low back. And we're just going to let the heels relax there. And we're just going to look to see which one seems to come closer towards her low back, towards her pelvis. That is typically the side that's moving freely. The reason the other leg wouldn't come as close typically is because of restriction in the sacrum back there. So in this case, it's probably hard to see from this angle. Really, her left leg is just not moving towards her sacrum, towards her pelvis the way that it should be. So in this case, what we're going to do is now move Mandy over towards the bench, and we're going to look at adjusting that left side of her sacrum forward. So once we've completed that assessment, and like I said, done a couple other verifications to make sure we know exactly what we're doing and what needs to be adjusted here, we're going to put you in side posture here, just like you've seen if you've watched the other lumbar and pelvis adjusting video that I've put up. Really, the only difference here is that part of that other adjustment, if you'll recall, involves me dropping gently against the thigh here to gap or open that joint just a little bit in the back so it's easier to adjust it. We don't do that in the third trimester, and usually not even in the second half of the second trimester. I don't involve that drop. Number one, because we don't want to take any risk of injuring AJ, of injuring the little one here. Now, if I were 6'5" and 280 pounds or something, that'd be more of a concern. I'm a smaller guy, so it's not really a worry, but we do want to pay attention to that. The other reason is, again, you've got the relaxin and the progesterone, you've got those extra ligament softening hormones, so typically we don't need to do that to gap the joint to really get the adjustment. But other than that, it is really the same adjustment here. We're going to put you in that fun pretzel position and tuck under just a little bit there for me. Good. Going to pull the shoulder down here just a little bit to relax the spinal muscles. Make sure she's not too twisted here. I'm going to find that sacrum contact point. Roll her towards me just a little bit. Push her shoulder up to loosen the muscles. Give her a little adjustment there. So once that's taken care of, she's going to roll flat on her back for us. And the next thing we need to pay attention to, the next step in Webster technique here, is really isolating and reducing or eliminating rectus abdominis trigger points. So I do a little dance here to figure out exactly where we want to be working. This kind of gives us a rough location, and then once we have that rough location, we just palpate around in there until we find that trigger point. You actually have one. Is that tender at all right there?
Nope.
No. Well, luckily it's not tender for her. So really the way you work with trigger points in this procedure is the same way that you work with it in any other kind of, oh, AJ's kicking against me there. That's funny. The same kind of thing, the same way you work with trigger point in any other kind of modality. You're just trying to deprive the area of oxygen briefly, which will help that area release. Now, sometimes this can take up to 5 or 6 minutes. We're not going to put you through that whole thing, but the point here is to keep pressure on that until that really loosens and relaxes. Now, that's essentially the end of the Webster protocol. What we do next is we move you, or Mandy, back over to the high-low, and we recheck for that sacrum restriction to make sure correction has been achieved. If it hasn't, we go through the whole process one more time. We do the sacral adjustment, we do the trigger point relaxation, and if you look at the textbooks, you don't really do it a third time. I've done it a third time, maybe once or twice, when I wasn't confident that I got a right adjustment, or as deep adjustment it was necessary, or I wasn't sure that trigger point really released. In general, though, we'll try that twice, and if things don't release, it's usually the body saying, whatever it is, maybe we slept funny, or we did baby and mama yoga or something this morning, so things just aren't in a position where the body's ready to release that. So we have you come back tomorrow and we try again. Now, this is, again, a really safe, conservative, easy, inexpensive intervention. I think the most I've ever heard of a woman going through this is maybe 8 times over the course of 2 or 3 weeks. Usually 4, 5, 6 over the course of 2 or 3 weeks is enough to release the tension in these anatomic structures so that the baby can assume proper vertex down position for delivery. And of course, we always have that correction in position verified by the midwife or the obstetrician, whoever else you're working with on the delivery. So that's about it for the Webster technique and the overview of chiropractic and why it's important and how it can help during pregnancy. Thanks again to Mandy and AJ for their time today. I imagine with an overview like this, you might have some questions. So if you do, please post them below the video here, and I'll check back regularly to try and answer those for you. In the meantime, you can wander around my website or check out the free blog or sign up for the free email newsletter. You can always email me or call me at the office for a free, no cost, no obligation consultation. Whether you're in pain and trying to get out of it, or whether you're just trying to have as healthy a kiddo as you can, you will be glad that you did. So thanks for your time, and blessings to you and yours.